Welcome, everyone. This is Sarah from the Cure SMA Family Support Department. Thank you so much for joining us today. We would also like to thank our national presenting sponsors, Biogen, Genentech, and Novartis Gene Therapies, as well as our platinum sponsor, Scholar Rock, for their generous support of the Summit of Strength virtual webinar series. We appreciate all of the questions we received in advance of this webinar, and we'll try to answer many of these during the presentation. You're also able to submit questions throughout the webinar using the chat box, which you'll find located in your GoToWebinar toolbar. Please note that all lines will remain muted during the webinar, other than for the speakers. If you have any additional questions after the presentation and Q&A, please contact the Cure SMA Family Support Team at familysupport@curesma.org. Now we would like to introduce our speaker, Jennifer Hubbell from Cincinnati Children's Hospital Medical Center, who will be presenting on SMA Standard of Care for Occupational Therapy. Jennifer?
Hi, everyone. Thank you, Sarah, for the introduction. Again, my name is Jennifer Hubbell. I am an occupational therapist with Cincinnati Children's Hospital. I've been there for about 24 years and have been working with kids with SMA for about 20 years. Currently, I'm full-time in the home care department, but I've also done outpatient therapy. So our plan for today is listed on this slide. We're going to go over a few things that I think that were important to go over, especially with today's climate. Next slide. First of all, let's talk about your role on the therapy team. Next slide. So your role on the therapy team consists of course, you, your child or adult member with SMA, any therapist involved in the medical team. So the first thing I want to say is that it's a good idea to be flexible, especially at this time for lots of reasons, but especially with all the new drug therapies coming out, things are changing so much these days. There's an expectation for two-way communication. It's not just one way from the therapist to you. It's definitely, we want feedback from parents, caregivers, patients, when it comes to setting goals, home programming, and things like that. There's definitely a focus on function. We want to write goals that are very functionally based. I like to start prevention early. It's a good idea. We want to think about things before they actually happen. And the best outcomes, we need to consider the values and the lifestyles of both the family and the child or adult, and do collaborative home programs, and that means set goals within the team, with all the team members participating, and the incorporation of the recommendations into the daily routine. Next slide, please. Exercise and activities. Next slide. I like this quote. It's actually kind of funny and very true. If exercise could be packaged into a pill, it would be the single most widely prescribed and beneficial medication in the nation. And wouldn't that be nice? If we'd all take that, I'm sure. Next slide, please. But unfortunately, it's not. So we actually have to be active. So interventions and frequency. Let's talk about that for a little bit. I'm going to talk about what we know and what we don't know. In therapy, we like to use evidence-based practice, which is using research evidence for clinical decision-making. Pediatric therapists have a lot of barriers in this process, and usually research in pediatrics has a low strength level, which means it's not very conclusive, or the study isn't big enough to study a wide range of people. So we're dealing with some barriers when it comes to actual therapy. Next slide, please. What we know, consequences of muscle weakness. We do know that it creates challenges with movement and function. It impacts breathing, upright postures, putting weight through the legs. It may limit positions and play activities, and it can also lead to muscle tightness and asymmetries that could lead to joint contractures, pain, and falls. Muscles that aren't used will lose strength. So if you don't use it, you lose it. Next slide, please. what we think we know about exercise and activity may be of value to maintain and increase strength for function. Natural history and experience helps us to predict which muscles will get tight and which muscles will be weaker, but we can't always be sure what activities or exercises are best to address those areas of weakness or tightness. However, our natural history is changing with all the new drug therapies coming out. So as things change, hopefully we will have more studies and more experience to know which areas we need to focus on, because different muscles are strengthening and different muscles are getting tight than what has historically happened with SMA. Maintaining and or increasing range of motion is beneficial, but does it improve function? My clinical experience says if you have not a lot of range in a joint, the function is decreased, but there's really not a lot of study or evidence out there that says so. Next slide, please. Strength training, what we do know. I've listed a few research articles on here, the results of some research on here, but as you can see, they're all fairly old, 5 or 6 years old. But we do know from this research that daily exercise is safe in ambulatory SMA and should be encouraged. Exercise in a home-based individualized program may maintain strength and increase a sense of well-being for children with type 2 and type 3, which is huge. We don't know yet if or when exercise leads to overwork or muscle fatigue. So that's something that we want to keep an eye on. We don't want kids or adults getting over fatigued. But as I said before, it's important to use the muscles that you have, otherwise they'll get weaker. So the bottom line is we need more research in this area. Next slide, please. Aerobic exercise may be challenging for weaker patients, but weaker patients can use slings and springs or activity frames to then suspend the extremities to help unweight the limbs and allow for better movement. But aerobic exercise is often neglected in this group, in the weaker patients, but it's still very important. Adaptive sports and equipment equals fun. Kids have a lot of fun doing things that other kids are doing. So things like swimming, Hippo Therapy, wheelchair sports, video games, yoga, Pilates, adapted activity programs are all really important. I know here in our area, our OTPT department has developed a program. We call it the Be Well program, and it's therapist-run adapted activity program when we partner with community providers and different recreational groups in the community. And it includes activities like running, rock wall climbing, hiking, gardening, biking, cooking, martial arts, yoga, and something they call Groove, which is music making and dance, which sounds super fun to me. They also provide adapted sport video-based education, and then they have giveaways and opportunities to register for lessons or sport exposures within the community partners that we've developed partnerships with. It's a really cool program. A lot of kids participate of all different levels. Some of the activities do require a minimum amount of function, but other activities like gardening are open for all levels of function. And in today's climate, we've done a lot of these activities remotely or virtually, and it's been really fun for the kids. So I encourage everybody to go look in your area. A good place to start is the closest children's hospital or the closest hospital at all. But a lot of like recreation departments in bigger cities also have some of these types of programs. Next slide. Okay, this grid talks about aerobic exercise, and it's actually from a consensus statement. So they take a bunch of research or a bunch of information and expert opinions and put it into this grid and talking about aerobic exercise. So the options on the left include things like swimming and walking and yoga and wheelchair sports. And they recommend duration of at least 30 minutes and a frequency of a minimum of 2 to 3 times a week, optimally 3 to 5 times a week to see effects from doing aerobic exercise with kids with SMA or adults with SMA. Next slide, please. This slide talks about stretching, again, from the consensus statement. Goals would be to maintain joint mobility, promote function, maintain flexibility. The modalities are what is actually used. So you're talking orthotics like foot or ankle braces, hand and elbow splints, standers and standing frames, and then just plain old range of motion or stretching. Duration, to improve length of a muscle, you need to stretch it for longer than 60 minutes. So that's when the orthotics and the splints and the standers come in. To maintain length, if you're just plain stretching, you need to hold at the end range for at least 60 seconds. And frequency, for the orthotics, you would use it both day and night, minimum of 3 to 5 times a week and optimally 5 to 7 times a week. That's what the consensus statement said. Next slide, please. Swimming and aquatic therapy. That's at least in our area, it's a pretty big thing. Kids have a lot of fun. They love to get in the water. So some benefits: buoyancy allows movement with less effort. So it encourages a wider range of movement in each of the joints. It's amazing what kids can do when you put them in the water. They can move things that they thought they could never move and parents thought they could never move. This also enhances their tactile input that the water gives on the whole body. It can reduce pain and tension in muscles. And you have a variety of head supports available. I have some pictures on the slide for different varying levels of head control. Of course, you want to protect that area. And ping pong balls can be put in pantyhose to support, and then tied around like your wrists or your ankles to support your limbs in the water to give them a little buoyancy. You definitely want to check with your local therapist that specializes in aquatic therapy, and if you can find one that specializes in kids with SMA or adults with SMA, that would be beneficial too. Next slide, please. Hippo therapy is another thing that can be fun for kids. Most kids like horses. Some kids are kind of scared at first because the animals are quite large, but it's definitely a whole body, whole sensory experience for kids. The horse is used as a treatment modality, so especially trained PT or OT would probably properly position the child on the horse and then directs the horse and analyzes the response. They watch the horse's movement and they watch the child's response to the movement, and then they adjust accordingly. It can improve posture, balance, mobility, and function. One thing I wanted to mention that for people that have limited head control, you may need to watch the weight of the helmet because the helmet can add a little bit of weight to the head. So you want to take that into consideration. Next slide, please. Alternative therapies can include things like massage, acupuncture, craniosacral therapy, chiropractor. All of these can be beneficial, but you definitely want to find a practitioner that is well informed of SMA and what SMA is. Next slide, please. Ways to exercise that may be more engaging. So I've included some pictures here. There's wheelchair soccer, which I had the opportunity to watch at college, a couple of college kids do a wheelchair soccer demonstration that they actually played for their college in wheelchair soccer, and it was amazing what they could do. There's an aquatic therapy picture of a child that's actually on a ventilator and how that can work in the water. Video games can be a way of engaging in exercise and activity. And the lower right-hand corner, there's a picture of a child with the slings and springs that I was talking about. It's an activity frame that can be made out of PVC pipe. There's a couple different ways you can do that. That looks more like a box, but you can also make it look more like a half box with legs. There's different ways you can do it. Pretty easy to make out of PVC pipe. And you're probably wondering what the picture is in the upper left-hand corner. That it looks like a metal shelf. I put this on here because some families have been very creative about how their kids are more bed-bound and how they use the slings and springs when they're in, say, like a bed or a hospital bed, and they've bought frames like this, and when they put them together, they just don't include the shelves in between. And these, if they're the right size on wheels, can roll right over top of the bed, and then their slings and springs can be attached with heavy-duty alligator clips to the top of the frame. And it's a portable way for them to use that on their arms or their legs while they're in bed or, say, in a wheelchair. Next slide, please. Flexibility. This is what we do know about flexibility. Benefits of range of motion or stretching, movement, and massage. We do know that it improves function and positioning. It provides the opportunity to be positioned in more varying ways, and it also helps with stability. It can decrease pain and increase comfort. A tight joint can hurt. It can be painful, so we don't want the joints to get to the point where they're really tight and painful. It can help with dressing and hygiene to improve it. If it's decreased, it becomes difficult for dressing activities and hygiene activities. Maintain skin elasticity. This is often kind of forgotten. We think about joints or muscles or tendons getting tight and contractures, but your skin can also get tight. And it can be very uncomfortable if your skin gets tight. So we want to maintain that skin elasticity. It can improve circulation, and then it improves sensory input. Next slide, please. How often and how long? What we think we know. This is what gets into the area that we're not quite sure per the research what is the best practice, but this is what we think we know. Holding a stretch longer is better for other conditions. So we do know that. So we assume that it's that way for people with SMA as well. So splints and braces, they're the things that hold the position for a longer period of time. So we usually recommend, if the kids can tolerate the braces, wear them overnight if they can do that. If not, definitely several hours a day. Consistency is better. Daily routines that are established will assure that the stretches are done more frequently. So if you can incorporate it into the daily routine, it will get done. Prioritizing muscles. This is something that the therapist can help you with. A lot of our kids have splints on different areas of the body. So they might have ankle and foot splints. They might have knee splints. They might have elbow splints, they might have hand and wrist splints. And of course, you don't want to put them all on at the same time, because that would be very uncomfortable. And your child or patient won't be able to do anything anyway. So you want to, along with the therapist, prioritize which areas to maybe focus on more, or get a plan or a schedule that gives them equal time. And a therapist can help you do that. Next slide, please. Bracing. This is from the consensus statement. So for the different types of bracing, the thoracic bracing are the trunk or back braces that we see that can help with posture and promote function in an upright position. cervical bracing, that's the bracing around the neck that can help for upright postures and with head control. And then you have your upper and lower limb orthotics. So they would promote function and range of motion in your legs and arms. So for duration, for promoting and maintaining range of motion, greater than 60 minutes to overnight is what we recommend. And I know you're probably thinking, well, that's a lot of difference, 60 minutes or 10 hours of sleep. The more, the better. An overnight might be 8 hours if they tolerate it. It might be 4 hours, and then you take them off and give them a break and maybe put them back on for, you know, the last 2 or 3 hours of sleep if they tolerate it, or during the day. Frequency, minimally 5 times a week, optimally daily, especially for those sitters. Next slide, please. So I'll briefly talk about hand splints. Since I am an OT, I'm more experienced with the hand splints. They can prevent deformity. You want to make sure that you weigh the benefits versus the pros versus the cons when it comes to added weight on their hands or their elbows, because it does add a little bit of weight. Even though the softer ones can add a little bit of weight, so it's something to be discussed with the therapists and the doctors, but they can be made out of different materials. Neoprene splints like the Bennick splints or the Mickey splints are made out of neoprene, which is wetsuit material. It can be very light, it's washable. They can be hot for kids that are sweaty, so you want to take that into consideration too. But then you have your thermoplast splints, which are the hard plastic splints, which a therapist would take the plastic and they usually melt it in hot water and they mold it to the hand or the elbow. Various thicknesses, they can be as thin as a 1/16 of an inch. There's 1/8 of an inch thermoplast. So you want to talk to your therapist about what's best for you. Kinesio tape is a great option. It's not really a splint technically, but you want to consult. It can work for certain muscle groups, especially the smaller muscles like in the hand and the fingers. You definitely want to work with a therapist that is familiar with kinesio tape and consistently get updated with them. But once they train a parent or a caregiver how to do it, you can get kinesio tape commercially now. It doesn't have to be purchased through therapy catalog. It can be bought. I think Amazon even sells it. But you want to be in touch with a therapist to kind of help teach you how to do it and then update you regularly on how to use it. Next slide. Play and positioning. Let's talk about some different ways to play and different positions to play in. Next slide, please. General considerations. You want to take into account respiratory status, work towards increasing tolerance or maintaining upright when possible, but you want to start slow. Don't go crazy at first if your child or patient doesn't tolerate being upright for very long. You want to start slow, and you want to take into consideration joint contractures and where they are as to how you position. Next slide, please. So supine or on your back is probably the easiest position. It's mostly well tolerated by most people, especially the little ones. You can consider the use of wedges to start working towards upright, and definitely monitor respiration as you go. Small pieces of foam cut into shapes, weighted bean bags, Z-flows, rice socks, which rice socks, if you're unfamiliar, are literally tube socks with rice put in them, and the tube socks are tied. A lot of families use them. They're super easy to make. And then when they get yucky, you just pitch them. But all of these things can help position and support extremities. You can even I've even had families, I know there's a picture of little foam pieces. They look like waffle, like things you put on like a mattress topper. You can get sheets of that and cut it into wedges or positioning helpers, or if you need a thicker piece of foam, you can go to like upholstery stores, and when they like redo couch cushions, they'll have leftover pieces of the thicker foam, and a lot of times they just throw those away, but if you ask for them to hold some, sometimes they will, and then you can take it and take an electric knife and cut them into wedges or different shapes to help for positioning. And then if you get super creative and you have somebody that can sew, you can sew like coverings for them so they don't get yucky, and then you can remove the covering and wash it when you need to. But positioning on your back promotes midline. You can work on head being in the midline, your hands coming to midline, things like that. Next slide, please. So sideline is positioning on your side. It allows for a midline head position, which is a lot of times more tolerated for the weaker kids. You can use a support to keep them in midline, so like a big body pillow or Z-flows or rice socks, something like that, to help keep them in midline, or excuse me, keep them in sideline. The child can see what their hands are doing and what their hands are touching, which is really nice because it directs the vision forward to where your hands are. It can improve access to toys. The shoulder motion is gravity eliminated, so the weaker muscles may get more function on your side than on your back. And the slings and springs that I was talking about with the activity frame, you can take your upper arm when you're on your side, the one highest to the ceiling, and put it in the sling and spring or the leg to get some gravity eliminated movement, which is really nice for kids. Next slide, please. Sitting is a great option if kids tolerate sitting. There's a varying amount of incline and upright depending on the seating device that you have, so you want to make sure you monitor respiration. And the optimal amount of support to promote function, it varies from child to child or person to person. So you want to consult a therapist to help you choose which seating option is better for you. There are a couple examples on the slide, and then a couple pictures of activities that kids do typically while in sitting, one being self-feeding. The next one is the little boy is working with an iPad, which in today's world with everybody, lots of people doing homeschooling, this is a great option for kids. Sitting upright also promotes cognitive function. It helps with attention and things like that. So if kids can sit upright, especially when doing activities and schoolwork, it's a good idea to try. Next slide, please. Technology. So we'll briefly talk about technology. Next slide. This is just a funny slide about how the alphabet, or the alphabet that's taught to kids nowadays. It's a little tongue-in-cheek, but it's very true, especially for most kids. They know how to use technology really quickly, so it's just kind of a funny slide. Next slide, please. Okay, a couple different technology options. First of all, I want to say that I am not promoting Alexa, Alexa Show, or any Alexa devices. These are just two examples that I came up with that a lot of kids are using nowadays, a lot of families are using nowadays, but kids with SMA can use to help them out. A lot of families are wanting kids to be able to have some control of their environment, and these devices can be used along with smart home devices, can be used to help kids be a little bit more independent. So for instance, the Alexa, like Echoes and things like that, they can be used for entertainment purposes, so they can play music through some streaming like Amazon Prime or Pandora. You can tell them to tell jokes. They can also do things like you can ask it to flip a coin or to roll a die. So say, for instance, if you want to play a game with the family, have family game night, and your kiddo with SMA can't hold or roll a die, they can tell Alexa to do it, and then they can still participate in the game with the family. It can also read books through like Kindle books and Audible and apps like that. It can also be used for communication. So a lot, if you have Alexa in each room of the house, they can be connected. So they can be used like a walkie-talkie to connect to other devices in other rooms. They can also, if you have phone numbers synced to them, they can also make phone calls, which is kind of fun if you want to give your child that much control or your patient that much control. But you can say, call mom, and it'll dial mom's number, and then you can have a conversation. Using smart home devices, like I said, like smart plugs and smart lights, and they've got all sorts of things now. You can use Alexa to turn TVs on and off, volume up and down, turn lights on and off, maybe fans on and off, things like that. So the Alexa Show is just an Alexa with a screen on it. Again, similar types of things. You can use it for entertainment. It can play music and play movies on it. You can use it for communication purposes. If you have, say, doorbell cameras and you can hook them up through it, you can connect to that camera using the Alexa or the Alexa while the Alexa Show, and then the camera will pop up on the screen. And then you can also video chat with friends and family, which is kind of fun. So I even have some kiddos that are that use eye gaze devices, and their eye gaze, they have communication pages on their eye gaze device. So they pull up the communication, because if they can't speak or talk, they pull up their eye gaze communication board, and then it tells Alexa what to do, and then Alexa does it for them. So that's a really nice feature. Next slide, please. Tips for telehealth. This is the last thing I want to talk about today. Next slide, please. I know most of you guys are probably at home, just like I'm at home right now, and I do telehealth visits as well. And I'm sure a lot of you guys are doing some telehealth visits either with therapists or with doctors. So these are just a few tips that I've put together to make them a little bit easier and a little bit more productive, because you don't want to waste your time. And sometimes people aren't sure what to do in telehealth visits because it's very different than an in-person visit. So first, you want to make revisit the frequency of your visits. If you were seeing, say, an outpatient occupational therapist on a weekly basis and you switch to telehealth, you can revisit the frequency. If you feel like weekly telehealth visits aren't really that productive, think about going to every other week or once a month to make them more productive. Make sure your technology is good enough to make the telehealth visits work. So for instance, since everybody's home, if you've got other kids that are in school, using their devices for school, and then you have somebody streaming movies, and then you try to do a telehealth visit, it might be difficult to get that good connection that you need for a telehealth visit. So you might want to schedule the visit at a time when not everybody's on the internet all at the same time. And then if the picture gets blurry, I am not a tech person. I should probably say that first. But if the picture gets blurry or pixely, a lot of times hanging up, just say it's not working, hanging up, and then calling back. A lot of times that'll fix it. But telehealth may improve access to therapy for people who have difficulty getting into an outpatient center for treatment. So maybe you don't live close to an outpatient facility, or you don't live close to an SMA specialty center, and you want to get some consultative visits with an expert. So this can provide access to some people maybe you didn't have access before. Both the child and the parent need to be ready need to be ready to be actively engaged during with the therapist during the entire session. This may be different if you're used to outpatient setting where that therapist just takes your child and then takes them back to a therapy room. This may be very different. So you want to be prepared that you're going to have to spend the 45 minutes or an hour to be actively engaged with what's going on. And it can take a lot of energy mentally and physically, so just be prepared for that. You and your therapist may gain new insights doing telehealth. I know when I have visits with my kids, I'm very hands-on therapist, and in telehealth, you can't be hands-on, so the parents or the caregivers are the hands-on people. It gives you a different perspective. So it may bring up some new issues that you may never have thought of, maybe the opportunity to address some new goals, but it definitely gives you a different perspective. It also can empower parents, caregivers, different family members to have a deeper understanding of what the therapy goals are and what actually goes on in a therapy session, and then what works and what doesn't work. Next slide, please. So if you're, say you're usually being seen in an outpatient setting, and now your outpatient therapist is seeing you via telehealth, it might give your outpatient therapist a kind of an inside look at your day-to-day life, which again, as I said before, can be very beneficial and very helpful. Because I am a home health therapist, so I see kids in their homes. So I have a very good understanding of a child's day-to-day activities and schedule, but outpatient therapists a lot don't have that don't have the opportunity to see those things. So it can open some doors in that area, and you can maybe address some new issues or some new goals. One thing that I like to do, I think is beneficial, is along with your therapist, make sure that you set like 1 to 2 goals for the individual session, so the expectations are clear. It's really easy to get carried away with talking about lots of issues and lots of goals, and then at the end of the session you haven't really gotten anywhere because you've run out of time and there's just too many things to address. So focusing on 1 to 2 things in a session, I think, is really beneficial and can make the session more productive. And then at the end of the session, kind of review what you learned, what you did, and then what the homework is. At the end of my sessions, I usually say something like, okay, this is what we did today. Make sure that everybody understands what we talked about. This is my homework that I'm going to do. If I need to research something or get some information for the family, this is what I'm going to do, and this is your homework. This is what I expect you to do in this time. So next slide. Okay, that's pretty much the end of my slides. If you have any questions, you can submit them in the comment section. I did get a couple of questions that were pre-submitted, so I just want to briefly go over those with you. The first one was about outcome measures in a multidisciplinary clinic. So a lot of outcome measures are used. It depends on which clinic, which area of the country, which hospital. Different clinics use different outcome measures, but I have a list of generally most of the outcome measures that are used. Your clinic might use a few, probably not all of them, so you want to check with your clinic to see. And if you don't understand what they are, please ask. Therapists are more than happy to talk about outcome measures, and we love to answer questions. So the first one is the CHOP and TEND. I think that's used pretty widely. It's just a measure of the ability, it's a measure of movement ability for children with severe muscle weakness. The revised upper limb module, or the RU LM is an assessment of arm function. Then you have the Hammersmith Functional Motor Scale expanded. It's an extended version of the Hammersmith Functional Motor Scale that was it was expanded to evaluate motor functions for kids with type 2 and type 3. Okay, I apologize, my cat just jumped up on the table. Sorry, everybody. And then you have the revised Hammersmith that's specifically designed outcome measure for people affected with SMA. So the Hammersmith Functional Motor Scale was the first outcome measure designed to capture physical abilities of people with SMA type 2 and type 3. So then they revised it and came up with like an updated version of it. Then you have the Bailey 3, which provides information on whether the child's developmental trajectory is in the cognitive domain is proceeding as expected relative to the same age peers. But it also looks at language, motor, social emotional development, and adaptive behavior. And then there's a 9-hole peg test that some clinics are using, which is a very brief standardized assessment of upper extremity function. So those are just some assessments that can be used in multidisciplinary clinics. The second question that was pre-submitted asked how important OT was in treating people with SMA. Of course, I'm extremely biased because I'm an OT, and I think each discipline brings a special something into the therapy team. So, you know, I work closely with physical therapists, with speech therapists, and then you have your specialist team, your neurologist and pulmonologist and maybe cardiologist and PM&R doc, and we all work together. But OTs provide a special overlook of the child or of the patient. We're very unique because we see the person as a whole. So we look at not only how they move their limbs and their muscles, but we look at that as it pertains to their daily function. So we might address feeding or dressing or toileting or things like that. But we also look at how they might function in school or work or leisure activities or daily chore activities. So we can bring a special perspective of looking at the whole person.
Great. Thank you so much, Jennifer, for such a great and informative presentation. And we really appreciate you taking the time to address these great questions that came in. And thank you so much to all those who did submit questions. And if you have any additional questions, you can always email familysupport@curesma.org, and we'd be happy to help answer those questions. So thank you again, Jennifer. We would now like to introduce Amanda Bradhurst, who is representing Genentech and will be sharing an update from Genentech. Thank you, Amanda.
Hi, everyone. I'm really hopeful that my internet cooperates today. I'm out in California and I think impacted by all of the wildfires. So those of you that are in this area, you probably know what I mean with all of the technical difficulties. So bear with me today. But I'm so excited to be here and talk to you a little bit today. So first of all, I want to thank Cure SMA for inviting me to join you all today. We are so thrilled to be here with you. My name is Amanda Bradhurst, and I am a Partnership and Access Liaison with Genentech, also known as a PAL. We have exciting news to share. And some of you may have already heard, but we just received FDA approval for Bristy for the treatment of SMA in adults and children 2 months of age and older. Next slide. This is a big milestone for all of us, and we want to take a moment to recognize and thank all of you who helped us along the way. We are so proud and honored to be part of this vibrant community. Many of you have provided feedback along this journey, and we are so appreciative. You not only told us but showed us how prioritizing individuals and families will always lead us down the right path. And for that, we are forever grateful. We also want to extend a very special thank you to every individual, family, and healthcare provider who participated in the clinical trials that made the FDA approval of Bristy a reality. Without you, we wouldn't be where we are today. Next slide. So what is Bristy? Bristy is a prescription medicine used to treat spinal muscular atrophy, SMA, in adults and children 2 months of age and older. It is not known if Bristy is safe and effective in children under 2 months of age. Next slide. Bristy is designed to work by helping to make and maintain more SMA protein, a key protein needed for nerves and muscles to function properly. Next slide. Bristy is being studied in more than 450 infants, children, and adults with SMA type 1, 2, or 3 from ages 2 months to 60 years old. This is also the first time a medication is being studied in people over the age of 18 years old. Next slide. The studies include 2 main studies: Firefish, which includes infants 2 to 7 months old with type 1 SMA, and Sunfish, which includes children and adults 2 to 25 years old with type 2 or 3 SMA. Jewelfish, a third study, is an ongoing supportive study which is looking at the safety of Bristy in people with type 1, 2, or 3 SMA who were previously on other SMA medications. Next slide. So now I want to talk to you a little bit about safety and share some information with you. Before taking Bristy, tell your healthcare provider about all of your medical conditions, including tell your healthcare provider if you have liver problems. Tell your healthcare provider if you are pregnant or plan to become pregnant. If you are pregnant or planning to become pregnant, ask your healthcare provider for advice before taking this medicine. Bristy may harm your unborn baby. Tell your healthcare provider if you are a woman who can become pregnant. Before you start your treatment with Bristy, your healthcare provider may test you for pregnancy. Because Bristy may harm your unborn baby, your healthcare provider will decide if taking Bristy is right for you during this time. Talk to your healthcare provider about birth control methods that may be right for you. Use birth control while on treatment and at least 1 month after stopping Bristy. Tell your healthcare provider if you are an adult male planning to have children. Bristy may affect a man's ability to have children. If this is of concern to you, make sure to ask your healthcare provider for advice. Tell your healthcare provider if you are breastfeeding or plan to breastfeed. It is not known if Bristy passes into breast milk and may harm your baby. If you plan to breastfeed, discuss with your healthcare provider about the best way to feed your baby while on treatment with Bristy. Next slide. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Keep a list of them to show your healthcare providers and pharmacists when you get a new medicine. You should receive Bristy from the pharmacy as a liquid that can be given by mouth or through a feeding tube. The liquid solution is prepared by your pharmacist. If the medicine in the bottle is a powder, do not use it. Contact your pharmacist for a replacement. Avoid getting Bristy on your skin or in your eyes. If Bristy gets on your skin, wash the area with soap and water. If Bristy gets in your eyes, rinse your eyes with water. The most common side effects of Bristy include, for later onset SMA, fever, diarrhea, and rash. For infantile onset SMA, fever, diarrhea, rash, runny nose, sneezing, sore throat, cough, lung infection, constipation, and vomiting. These are not all of the possible side effects of Bristy. For more information on the risks and benefits profile of Bristy, ask your healthcare provider or pharmacist. You may report side effects to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. You may also report side effects to Genentech at 1-888-835-2555. Next slide, please. As I mentioned earlier, I'm what we call a pal. This is a picture of my pal teammates and friends across the country. I'm in this picture on the left, and these are all of my teammates, and I'm so happy to work with them. We are part of the My SMA Support team, and we are the main point of contact from Genentech for people living with SMA. We can help provide a variety of things, including we provide in-person or virtual support based on your preference. We answer questions on Bristy, including how it works, how to take it, what results were seen in clinical trials, and important safety information. We explain insurance coverage and potential financial support options. We can refer you for helpful resources. It is important to note that we cannot provide medical advice. That should always come from your healthcare provider. If you'd like to connect with me or any of my fellow pals across the country, please do so. You can reach us and get more information about Bristy at bristy.com. We'd love to hear from you. Next slide. As I mentioned earlier, oops, I'm so sorry. That's about all we have time today for, but you can also get more information at bristy.com, including the results seen in clinical trials, how Bristy is taken, and more about the My SMA Support team. Thank you to Cure SMA for having us. We are so proud to be part of this amazing community. Thank you all again, not only for your time, but for your ongoing support. Our appreciation for all of you is boundless. Thank you for having me, and have a great rest of your day.
Thank you again to both of our wonderful speakers today for all of your time and your wonderful presentations. We appreciate everyone who has joined us on today's webinar. You'll all be receiving a follow-up email with a survey link, and we welcome any feedback that you have to share with us. We are also thankful for the incredible support from our wonderful sponsors for making the Summit of Strength virtual webinar series possible. If there is anything that we can do for you at any time, or if you have any additional questions, please email us at familysupport@curesma.org. Have a great day, everyone. Thank you.